Welcome back to the Nursing Ministry channel. Our new viewers, I welcome you, I welcome you, welcome you. Our returning viewers, as always, I'm very grateful and thank you for returning. This is a platform that was created to help you understand that there's a nurse in each and every one of us and how to utilize that nurse within us for the new viewers. Now, in case you feel lost, kindly watch our previous videos. You may understand from watching, you'll understand where we are at in this episode, because every episode is a build-up from the previous one. So once again, you are welcome. Now, for the returning viewers, if you watched our previous episode, we discussed about etiquette. I do hope you're putting the etiquette into practice, whatever you learned from our previous episode, that you are being kind, you are, being formal in, relating to, people, and just showing them that respect, because you do not know whom you are attending to, whether as a nurse in the profession or as a nurse in a ministry. We saw the story of Nabal, the foolish man who looked upon David in contempt, and that cost his life. So you do not want to be contemptuous towards people, especially if you do not know them, because you don't know whom you're handling. And then remember that Nabal died not because anyone had a hand in it, but God himself saw how he lacked etiquette and treated David with contempt or contemptuously. So having said that, we're going to look at a new topic today. And I'm going to take my time discussing this, because this is not just for the nursing student who is in college right now, because we've been looking at the courses that this nursing student should expect to be exposed to. But now this course involves each and every one of us. Not that the others did not, because I did tell you that at least I'm giving you a snippet to have an idea of, for instance, anatomy and physiology of the human body, and fundamentals of nursing. And for you to be able to have to use this information when you're caring for your loved ones, even if you're not a nurse professionally. But now with the whatever we are going to discuss today, it involves everyone. So much. It involves each and every one of us. The information I'm going to give can be used outside in our day-to-day life, or even by the nursing student whom we have been focusing so much on. So before I begin, I'd like to give you just a scenario, because I believe that all, if not most of us, have come across such a scene. For instance, when you are outside in your day-to-day life, you've probably seen a group of people or a crowd of people surrounding somebody that is on the ground, unconscious or bleeding or in pain, or just something is going on, especially where I come from. So in these scenes, you find maybe one person saw the person in distress, they ran over, they couldn't do anything, they were just watching. Before you know it, 2, 3, 10, 15, 20, 30, 100 people have crowded, and they are all just looking at this person. And while they are looking, the first person who came is being asked what happened. Then they relay, I just saw him, slumped down. He went down on the ground. Then by the time the next one comes, the story has twisted a little bit. It's like a broken telephone. All in all, time has gone. This person that probably they saw go down, not very unconscious, is now lying lifeless on the ground. So it is at that point that maybe they find a good Samaritan who offers their car to take them to the hospital. But when they arrive there, either they arrive dead or they arrive there in a critical condition that they don't even make it to discharge. Now, there is nothing new under the sun. Because this very thing that happens in our day-to-day life, maybe you've witnessed and also said, even if I stop, what can I do? I don't know what to do, so I might as well just keep going. Others, maybe you had more important things to you and you ignored and you went. Not knowing that maybe even the person you've left there is somebody you know, or even a family member who had left the house hours before you. Anyway, we're going to discuss that and how to remedy all this. Like I said, there's nothing new under the sun. In the Bible, we also have such scenarios. Remember our first episode where I talked about this a man who had been waylaid. He was traveling from Jerusalem to Jericho, and he had been waylaid, left for dead. Then a priest came by, passed, the Levite came past, didn't do anything about it. But when a good Samaritan came, he took him up and took him to the inn. Watch our first episode. That is a similar situation. There were those that stopped and just saw the situation and went their way. But there's one that stopped and then took action and, did something about it. He bound his wound, put oil, bandage, and this man made it. Another, that is in Luke chapter 10, thereabout, the middle of Luke chapter 10. But then now we are looking at Luke chapter 5, middle part of the chapter. You will find another similar story. Jesus was having a meeting with the teachers of the law and the Pharisees. And so some men decided to take their friend who was paraplegic. He couldn't move his body. He was just lying there. So they put him on a mat and took him to where Jesus was holding the meeting. But when they got there, they found the place so crowded that they couldn't go through the door. So they decided to go up on the roof, made a hole on the roof, and then lowered their friend, maybe using ropes, right in front of Jesus. Because the power to heal was there. The Lord had given Jesus that power to heal. So there was power to heal, and they lowered this man on the mat right in front of Jesus. Look what happened. Normally, in the Bible, you'd hear Jesus look at somebody and say, "Your faith has made you well." But in this case, Jesus looked at the men who brought this paraplegic patient to him. He looked at their friends and saw their faith, and he said to the man now on the mat, "Your sins are forgiven." Well, eventually that was what really healed him. Your sins are forgiven. There was a bit of contention. Then he told him, "Get up, pick your mat and go." That man was made whole, and the people were so much in awe, thinking, "We've never seen such, this is the most remarkable thing we've ever seen." So I want you to hold on to that thought, because I'm going to refer to it on our discussion today. Now, we are going to discuss basic life support. That is a course in nursing school. Basic life support. In short, we just say BLS. Now, much as a student will expect to learn this is a course that is taught even for non-nursing students, professionals, We will discuss about that too. However, I want to just help you understand what BLS is and how it plays a role in you. Taking action whenever you see such a sin outside the hospital setting or even within the hospital setting, there is something you can do about it. So the basic life support, as the name suggests, basic is doing basic things to support the life of somebody else. Simple as that. Doing basic things. It is not complicated. And this can be used to support the life of somebody else, somebody who is losing their life. Now, for the basic life support, it can be used under various circumstances, of course. For instance, as somebody who is choking, somebody who is drowning, one who has a stroke, one who has cardiac arrest, one who has anaphylaxis. Anaphylaxis is a severe allergic reaction that even shuts down the airway. It is a life-threatening emergency. So these are different things that somebody may encounter, and the BLS will help save that person's life because they are helpless at that time. However, in our episode today, I'm going to to begin with, I'm going to focus on the cardiac arrest situation. And then later on, I will now help us understand how to intervene whenever somebody has anaphylaxis or they've drowned or they're choking and all. So let's start with the cardiac arrest first. So the objective of all this, you may ask, why do we need to learn? Or what exactly are we going to discuss? So I'll just give you 3 pointers. I need you to understand how to respond quickly and confidently. Whenever you see such a scene, you will be able to respond quickly and confidently, because I will have helped you understand what to do. And then secondly is to recognize what cardiac arrest is, or how to recognize that this is cardiac arrest. Because you may go to a scene and the person is lying lifeless. How will you know that this is cardiac arrest and this is exactly what I'm supposed to do? Because other situations like diabetes may present in the same manner. Then the third one is to activate the emergency response early. You will activate the emergency response, maybe shout for help before you start doing anything and all that. Once you've recognized this is cardiac arrest, you shout for help, call for help before continuing. Because if you start doing what you want to do, time is going, and with cardiac arrest, every second counts to determine whether this person will live or not. So 3 objectives: to respond confidently and quickly, to recognize cardiac arrest, and to activate the emergency response early. All right. So you may say, why is all this important? I'll tell you that statistics says that about 50% of the cardiac arrest that happens is unwitnessed, meaning no one saw this person get this cardiac arrest. They were found maybe in their bedroom. They had the cardiac arrest maybe even in the night or just 10 minutes ago, but they are found lifeless. That is one. So unwitnessed means you did not see it happening. You did not see them go down. You did not see them collapse. You are somewhere and you just found them in that situation. So 50% of the cases are unwitnessed. Then secondly, 10% of these cardiac arrests that have happened and had the emergency response services like the ambulances come to take over. Maybe you found them, you called ambulance comes and does whatever they want, or the emergency medical services, and they take them to the hospital. These people who are taken to the hospital, only 10% of those taken will survive to discharge, meaning they may still be alive when the ambulance comes. They are taken to hospital and admitted, care is given to them, but only 10% of them make it alive out of the hospital, despite having made it alive to the hospital. Why? The prognosis is poor. And that is because nothing was done immediately it happened, at least to increase the chances. So having seen the statistics and that the prognosis is poor, that means if you learn the BLS, basic life support, you increase the chances of these people living double or even triple times over. So if in your town or your city, they have recorded 5,000 people had cardiac arrests in, let's say, the previous year, 2024. If 5,000 had cardiac arrest and 10%, and they were taken to the hospital, 10%, which means 500 of them had a chance of survival. But if you had intervened before even calling the emergency medical services or rushing them to hospital, it means double that. 1,000 or even 1,500 could have had a chance of survival. And so that is why it is important for us to learn. It is not a complicated thing at all. If you stick with me and listen to what I have to say, you will see how easy it is to intervene in a situation and save somebody's life. That is why I have brought up the story in the Bible. Look at the people who intervened. If that man was left for dead in Luke chapter 10, he was left for dead. So if the good Samaritan, the third person, also came and left, that means he would have died there because he was badly beaten. That was a parable. But because he took the chance to do something about it, the man lived. Same thing with this friend who was on the mat. When the friends took an initiative and picked him and took him to Jesus, who could do something about it. Had they left him there and thought this is none of our business as long as he's alive, that man would have died a paraplegic. But Jesus saw the faith of the friends and healed the man. And he went away rejoicing that he had a new lease of life. So do the same too. As I teach you the basic life support, just take the 2 or 3 pointers that I'm bringing forth and respond quickly and confidently to a scene. Just respond and do your part. We treat and the Lord heals. So do your part in whatever I am relaying to you and leave the rest to the Lord. Who knows? Jesus may look at your faith and heal the person that you are saving or whom you have responded to. So having said that, we're going to look at some descriptions to help you understand the basic life support. And the first one is the personal protective equipment. Of course, the personal protective equipment in the hospitals, they are well stocked. They have from the head covers, the eye protection, the masks, the shield, the gowns, or even full body shield, the overall that they put on to cover themselves completely. They have the medical gloves, they have the protections for the shoes and all that. Now, this may be limited outside. However, it is good to know that your health and safety comes first. Much as you want to help somebody else, your own safety and health should come first for you to be alive, to even care for this person whom you have responded to quickly and confidently. So, you've heard the scripture that says, love your neighbor as you love yourself. The level at which you love yourself enough to protect yourself is now the level that you're going to use to love your neighbor, to help your neighbor. So if you are well protected, you may even do much more to help somebody who is dying than when you will be so conscious about, I'm doing this, but I don't have a mask. What if I'm contracting what this person has? I'm touching all this. What if I get infected? So you may end up doing less. But if you are well equipped, you will do much more. But stick with me. Understand that these personal protective equipment are important. Your health and safety will come first. So if you respond to a sin that is a risk to your life, you may not be able to do so much at that point. For instance, there are bullets flying all over, and you're seeing somebody who's not been shot, but they are going down with cardiac arrest. Will you run to the scene while the bullet is flying? No. You will first find a way to pull the person away from that scene in order to help them from the side. You won't stay there because you could be shot right on top of that person. So your safety will come first because you'll find a way to pull them away to safety and then perform your basic life support. Now, it is important to understand that there is a technique and a sequence to this, which is good because it makes it easier. You won't feel like this is complicated. I have to go through a course in college to learn all this. No, it is just a sequence that when you follow this, you have mastered the art of basic life support. And it is good when you keep practicing, even if the victim is not there. And I will show you how to do that. Now, the responses to all this, the response varies. It is not automatic that when you do this basic life support on the patient or the victim you have found, it is going to be 100% guaranteed that they will come back, they will have a return of spontaneous circulation, like they will come back to life. And there are 4 major things that will determine their response. 1, are there available equipment? Like I've just mentioned, the personal protective equipment. Do you have a helmet? For instance, if it is an area that has a construction site, and yet there's construction going up there, there are debris falling. Do you have the helmet, for instance? Another thing, do you have the mask or do you have the medical gloves if it is a situation that warrants it? If it doesn't warrant it, go ahead. But if it really warrants it, your safety and health risk comes first. So the availability of these things will determine the response. Why? Not because you will say, I won't do it because I don't have medical gloves. But it may delay you beginning. By the time you get the medical gloves to start working on this victim, time has gone. And that will determine whether they live or not make it to discharge or even to the hospital. So the medical equipment availability is one of the things that determines the response of the victim. Then number 2, availability of trained responders. You see, like right now I'm talking to you, you are not trained. You don't have an idea. You are probably one of these people that saw a scene or an accident and you passed because you're thinking, even if I go there, I don't know what to do. There's nothing I can help them with. I'm seeing cars parked. Maybe one of them will take them to hospital. Let me go on my way. You may be one of those. But now when you are trained, when you have the information and you are in the scene, you will be able to respond. So a scene that does not have anyone trained determines the response of the person, because now all people will do is just probably pick them after talking. They decide, let's put them in the car and take them to hospital, or can somebody call 911 or the emergency number. So all this time that has gone is making the situation worse for that victim. So once again, the number 2 is the availability of trained responders. And then number 3, even if the trained responders are there, what is their level of expertise? They may be there, however, they do not quite know exactly what to do. They don't know how to recognize whether it is cardiac arrest or not. They don't know whether they are dealing with diabetes. They're not so sure. Or they may know, but they don't know, okay, once I recognize that this is cardiac arrest, or this is drowning or choking, what do I do? Okay, do I compress on their chest, or do I first give them air, or do I turn them? So you are not sure. You know some bits and pieces of the whole response, the basic life support, but you don't know exactly. Or it is an anaphylaxis reaction. They've been stung with a bee, but they've reacted so differently that their airway is closed. Okay, even though I know I have to give this injection that is in their pocket, because they know that they have anaphylaxis reactions, but where do I inject it? Do I inject it on the arm, or is it required to be injected on the thigh? So the level of expertise will determine how that patient responds. They may make it alive, but with some disabilities, or they may end up not surviving. So level of expertise of the available responders. And finally, the local protocol. What is the local protocol? Wherever you live, the town you live, the city you live. In some places, they're advantaged. You simply press 0 on the phone. Somebody picks up the phone, asks you what is the emergency. You tell them, I'm in this place, I'm at that place. I've just met this man, he's collapsed. That person, we call that TCPR or telephone CPR, may start giving you instruction over the phone. Okay, we're sending an ambulance right now, but do not leave the scene. Do this, turn them, do this, okay, count this, okay, then put this, and then by the time they're doing this, the emergency medical services have arrived. Those are the privileged ones. However, in some areas, you will call 911, the phone may ring and ring and ring, no one is responding, or you're in an area, you shout for help. The people who come, maybe your neighbors are advantaged. They have something called an automated external defibrillator that may help. Or others when you shout, no one responds because it's a big neighborhood, no one can hear you. So the different protocols, even if the emergency medical comes, some may be told before the ambulance comes, you have to deposit a certain amount for us to show up because this is a private, what have you. So the local protocol will determine the response of your victim. 4 determinants that I have mentioned. Are there available medical equipments? Are there available trained responders? What is the level of expertise of these trained responders? And finally, what is the local protocol? So all this will determine the response, but it shouldn't scare you. I'm going to help you give you some knowledge on what you can do. Now, like I have said, I won't touch on drowning and choking and stroke and the anaphylactic reaction today, but I'm going to really focus on cardiac arrest. Now, you've heard of cardiac arrest. It is different from what you hear, heart attack. Heart attack is when there's a blood clot on the wall of the heart. Remember, we went through anatomy and physiology. When there's a blood clot preventing blood from flowing on the muscle of the heart, that is a heart attack. because now it prevents the oxygen and the blood from getting there. The person ends up with pain, and it may take a while before maybe they pass on, It may take a few minutes, hours, depending on the severity. However, cardiac arrest is when the heart is arrested. The heart normally does this. It contracts, relaxes, contracts, relaxes. So when we have a cardiac arrest, it's been arrested. It can't contract again. So when the heart is arrested like this, and the whole body is depending on the blood that is being pumped here to reach to the farthest of the cells, and also depending on this pumping to return the blood that has waste or deoxygenated back to the heart, and then pumped to the relevant organs for cleansing. So if this vital organ fails, everything else in the body fails. It doesn't matter if your brain is okay or the liver or the kidney, they were healthy. If there's no heart, there's no life. That is why it's important for you to learn on what to do in basic life support. Now, whenever you have cardiac arrest, there's something called cardiopulmonary resuscitation. Simply put, CPR that can be done, and you can do it. You who is on the street, you who is in the shop, you who is at work, in the office, you can perform CPR. It is very simple, and I want to introduce you to it in our episode today. Now, when you hear cardiopulmonary resuscitation, CPR stands for cardio, for C, the P stands for pulmonary, and then the R stands for resuscitation. Cardio is just another term for heart. Pulmonary is another term for lungs. And then resuscitation is to bring back, to revive, bring back to life. Remember, we're talking about basic life support, and there are different situations: cardiac arrest, drowning, choking, anaphylactic reactions, and all. But today I said we are focusing on the first one, cardiac arrest. Now, cardiac arrest is what we use CPR for. We do not use CPR for maybe choking, CPR for anaphylactic reaction. Unless, of course, they've had that anaphylactic reaction, they've gone into, no, let me not confuse you. Let's just stick with that first. CPR is done for cardiac arrest. So you may say, how will I know this is cardiac arrest? I can't look inside their heart to know that the heart has been arrested in one position. And whatever has arrested this heart is the electrical impulses have stopped or have failed, are defaulted. Remember I told you about the neurological system, that there are some electrical impulses that now trigger the muscle to contract or to relax. So when that electricity around your heart now is faulty, the heart cannot move. It's like a generator that you're trying to on, or a car that you're trying to start. If you are trying to start and the engine is not sending those whatever impulses, that means you can't jump start it. You can't start it off. So the same thing with the heart. If the electricity is faulty, the heart cannot be commanded. The muscle cannot be commanded to contract and relax. So it needs you to jumpstart that heart. And that is what we call CPR. Your effort in trying to make that electricity impulse pick up again is what is called CPR. Now, having understood that about that CPR stands for cardiopulmonary resuscitation, we're dealing now with the heart, we're dealing with the lungs, and we're trying to restart them. You may say, how will I be able to identify? How can I recognize? Remember our objective. How do I recognize this is cardiac arrest? Or they are simply diabetic, they don't have enough sugar, and so they are unconscious. Because for diabetic, at that point, we'll put sugar into them and they will, be revived. But now, cardiac arrest, for you to determine this is cardiac arrest, I need to start CPR immediately. Number one, there are three things that will tell you. The person will be unresponsive. No matter how much you call them, they are not responding to you. Or stimulate them, they're not responding. Number two, when you check their pulse or their heartbeat, it is not there. And number three, they do not have normal breathing, either absent or normal breathing. So let me help you now. How will you check their responsiveness for you to know whether they're responsive or not, so that you don't start pressing on somebody's chest and yet it is not cardiac arrest? You call them. When you meet somebody unconscious, the first thing you do, determine first. Maybe they're sleeping, they're in deep sleep. They were so tired and slept off. So they're on the sofa set, maybe as I am seated, and then I just fall asleep and I'm in such a deep sleep that you've been calling me from the kitchen or the bedroom and I cannot hear you. So go ahead and tap them. Tap them and call them, Ludia, Ludia, Ludia. And when you're calling, try coming next to the ears. Maybe I'm hard of hearing on this side, or I'm laying on this side, so I can't hear you calling me. So call me Ludia, Ludia. Come this side, Ludia, Ludia. So if you're stimulating me and calling me and I'm not hearing you, then you are able to say I am unresponsive. This is not sleep. I am unresponsive. Whether it is from diabetes or what, you still do not know. But at least you've determined the first thing, that I am unresponsive. Then the second thing that you do, go ahead and check my breathing. Am I breathing? So, am I breathing, and is the breathing normal? My normal breathing is this: inhaling and exhaling, breathing in and breathing out. So my normal breathing is you can see my chest rising. It's going up, in and out and in, out and. So this is normal breathing, in and out. That is normal. It is not too fast, it is not too slow, but anyway, that is a normal breathing. It is present. Now, there's another breathing that is not normal. So you'll check for two things. Is there breathing? If it is there, is it the normal breathing? Because there's a breathing that you may think is normal, and yet it is abnormal, and it refers now to cardiac arrest. So, either the breathing is not there, that is cardiac arrest. If it is absent, definitely cardiac arrest. But look at this. The breathing may go something like this. That is not a normal breathing. So number one, the person is not responding. You have determined by stimulating them. Number two, their breathing, either it is there, but it is not normal. That is another factor you are considering. Or simply it is not there. It is not there. Then the third one and final one is the pulse. The pulse is the heart beating. So when the heart is beating, the heart is located on the left part of your body. Check your left arm. On the left arm, for the ladies, somewhere under the breast. That is your left side. Your heart is not here. Your heart is not here. Your heart is not here. Your heart is located on the left part, especially the upper part of your chest. So the left upper part of your chest. So you can check your armpit, somewhere around your armpit and your left breast for the ladies. For the gentlemen, of course, you also have breast, but on the left side. So when your heart is beating, that beat, the contraction and relaxation, makes a sound, lab-dub, lab-dub, lab-dub. So when we have the stethoscope, we can hear it more clearly. So if you listen to the heartbeat from the chest, like try putting your ear on the chest of somebody near you. It may be more clear with the males. When you put your ears there, you will hear the beats. But the ladies too, put your ear on the chest, ladies for ladies, and whatever sound you hear, that is your heart beating on the left part of your chest. And we call that the apical pulse, meaning the pulse on the apical site. The site is the apical or the apex of the heart, the top part of the bottom part of the heart, the apex, but don't mind about that. This is the apical pulse. So you will hear the heartbeat there, or on your neck. This is the windpipe. We call it trachea. So right here, when you put your 2 or 3 fingers there, try searching for a heartbeat. Again, you will hear didn't. That sound is a heart rate. Your heart is beating. So it tells me, yes, your heart is beating. There's another part. This is called the carotid pulse. Carotid pulse. This one apical pulse. This one is carotid pulse. Then we have here on the arm, right here. When you put your 2 or 3 fingers, search for it, be still and just listen. You will hear pulses. This is the brachial pulse. For the infants and the children, it may be somewhere a little bit higher. You may hear it somewhere here. But for the adults, search for it. And that is the brachial pulse. Then we have the radial pulse. It is on the wrist. Maybe you've been to the hospital or clinic or the doctor's office and they hold your wrist. So what they're trying to feel for is your pulse. All this is the heart beating. So this is called the radial pulse. Then go to your knees and circle to the back of your knees. And then put your 2 or 3 fingers there. That is called the popliteal pulse. It is behind your knees. Put your 2 or 3 fingers and try to feel for the heartbeat. And then on the groin area, when you're sitting, where there's a bend, where there's a fold between your thighs and your waist, that is the groin area. Put your 2 or 3 fingers, listen to the pulse, whether the left or the right, but when you listen, you'll feel for the heartbeat again. That is the femoral pulse. And then on top of your foot, between your big toe and the first toe, on top of the foot, again, put your fingers and search. You will hear the heart beating. Ladies and gentlemen, we are fearfully and wonderfully made. The Lord knew that when we check for the dorsalis pedis pulse on the foot, if we can't find that pulse, and yet we are able to find the popliteal pulse behind the knee, that means the blood is not flowing to the foot. If we can feel the one behind the knee, how come we are not getting the one on the foot? There may be a blockage in between, and we need to find out, because it may be a blood clot preventing blood from flowing all the way to the foot. Similarly, if we can feel the femoral pulse on the groin, but we can't feel the one behind the knee, we can't feel the one on top of the foot, that means there's a blockage and something needs to be done fast. Because if this blood is hindered from flowing for a long time, the leg could turn gangrenous, and that is what leads now even to amputation. It will be cut off because there's no blood supply. So all these pulses, I am telling you, back to cardiac arrest, are important for you to determine whether this person has cardiac arrest. Now, you won't go for the foot, you won't go for the groin, you won't go behind the knee. It is important to know this one here, the carotid pulse, and this one on the brachial pulse. So for the adults, we will focus on the carotid pulse. But for the infants, because they have a bigger head, it may be hard trying to locate where the carotid pulse is. Their heads are much bigger. So for the little ones, we use the arm. But for the children and the adults, you use this. So when you check the pulse and you can hear it beating, you know their heart is pumping. So you rule out cardiac arrest. That heart is moving because you felt a pulse. Now, 3 things to determine cardiac arrest: they are not responding to you, they do not have a pulse, and their breathing is either absent or it is not normal. Now that you've determined, what do? You jump into action. You perform what we call cardiopulmonary resuscitation. And not just cardiopulmonary resuscitation, it has to be high quality cardiopulmonary resuscitation. You know there's a difference. Look at our Bible story. If the friends of this man took him and then went to the roof, and let's say the roof was high, then they decide not to use ropes to lower their friend in front of Jesus and just drop him, the man could have died. Yes, they helped him, they took him to Jesus, but they dropped him. So he came flying and he struck his head and died. Of course, Jesus would have resuscitated him, but they would have done a good thing in a wrong way. So it's important to know that when I'm teaching you CPR, follow the techniques I am showing you, follow the sequence I am showing you, and you would have not just done CPR, but you would have done high quality CPR. And it is very, very simple. Now, to introduce CPR, because we'll continue in our next episode, the whole dynamics of it. Just to give you a rough idea about CPR, it involves just two major things. One, remember you did not get normal breaths or they were absent. And remember, when you checked the pulse, it was not there. So what you're going to do is to compress on that heart for the heart to beat and return the pulse, and you're going to give them breaths. Breaths, you're going to give them air, you're going to give them some oxygen or breaths into their body. So two things, you're compressing the heart and you're giving breaths. That is what CPR is all about. Compression and breaths, compression and breaths, compression and breaths. Ladies and gentlemen, this done in a high quality manner will determine whether this person will make it alive after discharge from the hospital or they will die. It will determine whether we have a 10% surviving to discharge or we're going to have 20, 30, 40, 50%. Because you who has no healthcare background, you have never studied, this is the first time you're hearing cardio, you're hearing pulmonary. This is even the first time you are knowing that your heart is right here. And that to know the heart is beating, we have pulse points around the body. But you can still do CPR and save this person's life. And so in our next episode, we are going to look at the CPR. Watch out for it. I'm very grateful that you stuck by. Please go ahead and practice identifying the pulses I have mentioned, so that in our next episode, when I'm talking about it, at least you have put your 2 or 3 fingers on your neck, you have listened on the chest, you have checked the brachial pulse, you've checked the radial pulse, the femoral pulse, the popliteal pulse, the dorsalis pedis pulse, and you have been able to identify for real. The heart can be felt all that in all those points. And also the breath, practice checking out the breath of somebody seated next to you. It doesn't take much because you'll see their chest rising or falling, especially when that person in your vicinity is asleep. Because the victim of cardiac arrest, you'll find them, they will be unresponsive. So when you look at their chest rising and falling, listen also to the breath. Put your ear, if you're not seeing rising and falling, you can put your ears to their mouth or to their nose. Are you hearing them breathing? The breath sounds. Can you hear anything? And is it normal? So that when you hear, that is not normal breathing. But when you hear it in and out, you know I'm dealing with normal breathing. Then thirdly, feel. You know when somebody is breathing and you put your cheeks on their mouth, it is warm on your cheeks. So if you feel some warmth, even though you may not quite hear much, you know there's breath coming out. This person has some breath in them. And it is warm. Because it comes warm, then it dissipates, then warm, it dissipates. So it is not complicated. I will teach you in our next episode. We are going to start doing CPR. We found our victim unconscious. We are doing, we are stimulating them to wake up. They are not responding. We check their pulse. At the time we are checking their pulse, we are also looking at the chest. We are feeling there's nothing. And we only have a window of 10 seconds to determine all this. The calling, the checking the pulse while looking at the breathing, at least 10 seconds. Statistics says that if you do this checks, at least within 10 seconds, there's a higher chance of them surviving this cardiac arrest than taking longer trying to figure out, you're screaming, you're shouting. Instead of screaming and shouting, simply jump on the chest, start pumping on their heart, and giving them breaths. But while you're doing that, you have already signaled for help. You've shouted, help! I'm on the road by the tree. I'm near this shop. I'm near this building. Please, somebody help. You have signaled for help. So don't say in our town we don't have ambulances. Forget about it. We don't have what have you. This cannot work. When I say calling for emergency response early, what I'm referring to is even shouting for help. When you say help, whatever language you use, whether Swahili, no matter the tribe you are from, call for help using the language you know. And then tell them where you are. Because if you say help and they keep running around, they're wondering, help from where? Where are you? Where are you? All that is buying time. But if you say, help, I am in the sitting room. Help, I'm in the kitchen. When you say that, help, and you're calling them, you can even give instruction. Help, I'm in the kitchen. Call 911. There's this and this situation. So before the person comes to find out what is happening and then running back to get their phone, that is buying time. But when you're shouting for help for somebody who can hear you, help, I'm by the road. Please, there's a cardiac arrest. Call 911. They will be doing that and then come to help you pump on this person's chest. And that is what you're going to learn in our next episode. Don't miss out. Come and be of help to somebody. Learn something, just something to help somebody. And who knows, you may be passing your own relative, your own family member who left the house. God forbid that it happens. But should it happen, this is the help you have received. The knowledge, go ahead and apply it. In the offices, go ahead and apply it. And then I'll let you know at the end that there are hospitals or organizations that train. They just help you get the hand of what I am teaching you. I am relaying this information, but this is what you will be taught. And you'll have hand skills, practice. And no matter where you'll be, whether in the office, if you see a colleague unconscious, whether you've witnessed or it is unwitnessed, you'll be able to do something about it because there are basics to it. Once again, my name is Ludia Osita. I'm so grateful for joining me in today's episode. You have a beautiful day and go ahead and practice identifying where the pulse points are. Remember, do your part. Let Jesus look at your faith and heal this person. Because it is you who just treats and the Lord himself is the one that heals. But do your part. Do something about it. Until our next episode, have a wonderful day. Goodbye.